I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I'd like to spend a few minutes talking about your facelift surgery, specifically preparing you for what to expect after a facelift procedure. Remember, there are two basic types of facelift: a full facelift and a facelift that is more limited, or otherwise known as a mini facelift. The recovery after both of these procedures are going to be slightly different. In a full facelift, the thing you can expect right after surgery is that your head and neck will be wrapped with a circumferential wrap, making you look a little bit like a mummy. You're also going to have drains which go into the neck, which will come out and be connected to some bulbs, which will attach to your head dressing. You simply empty those bulbs as they fill up the first night. Other than that, in the first 24 hours after surgery, there's really nothing special to do. I like my patients to keep their head elevated and just keep the wrap and the drains in place for the first night. Now, you may be having other procedures with that facelift, such as eyes, nose, and so forth, but we're talking specifically here about as if one was having an isolated facelift only. The next day I will see you. I like to see my patients to get the big dressing and the drains out the very next day. After that, you will simply be placed in a little neck wrap to keep a little pressure on the neck over the next week so that the skin sticks down well and gives you that nice sharp neck angle that you are after. You may shower the next day. You do not have to worry about getting your sutures wet. They are all dissolvable, the suture line that runs around the ears. You might want to keep a little bit of antibiotic ointment on that suture line, which really just keeps the sutures soft, keeps them from drying out, and helps them to dissolve quicker and causes a little less red reaction around the suture line. Otherwise, you can eat and drink whatever you like. Activity-wise, you can do whatever you like, short of not strenuous physical activity the first week, and I certainly would avoid bending over and keeping your head below the level of your heart, which might cause some bleeding and extra bruising if that occurs. You will find that surprisingly you have very little discomfort. Most patients state that they have no pain at all. The main reason for that is the skin is numb where the skin flaps have been raised up, and that really has no feeling. It will take about 3 to 6 months for all of that feeling from a full facelift to come back. So don't find that it's abnormal if you find that your skin is numb. You will find that when you get out at about 7 to 10 days, you're going to look fairly non-surgical. You may have a little bruising low in your neck, but short of that, in an isolated facelift, because remember the rest of your face has not been operated on, you're going to look fairly good quite quickly. Again, if you have other procedures such as eyes and rhinoplasty and so forth, that is going to extend your social recovery somewhat longer. And when you get about 3 weeks, you're really about 90% there in terms of having the final result. You are going to feel some lumpiness and some irregularities in the neck area, and that is exceptionally common after a full facelift. And it will take up to 6 to 8 weeks for all of those little areas to go away and feel normal again. It is certainly normal to have a little tightness in the neck area because that is certainly what you want in the long term. But that sensation or feeling will go away within several weeks to a month after surgery. Now, when you have a more limited facelift, the recovery is much quicker and much simpler. In a limited facelift, the incision is just in front of the ear, inside and outside of the front part of the ear. The skin flaps that are raised are much smaller. I do not use drains in those patients after surgery. You have a head wrap for the first 24 hours, just like the full facelift, and then that comes off the very next day. You may go ahead and shower. Again, there are no drains to take out. You will find that you will have some mild amount of swelling and bruising, but it will be less than what you would see in a full facelift. Most patients look pretty good in about a week from a limited facelift, and really there's nothing special to do after the first week in the more limited facelift. So this will give you some information about your facelift surgery and what to expect after that procedure. I look forward to seeing you if you are my patient, and I wish you the best of luck in your facelift experiences. I'm Dr. Barry Eppley of Indianapolis.